I teach critical psychology in the BA program, which is actually my favorite class that I teach in Antioch. And the reason I actually wrote that class was my interest in how we think we even know what psychology means in the first place. What is psychology and who determined it? How did we decide about what it means to be mentally ill or mentally healthy? And to really deconstruct the whole, what has, and so I hope that in your time at Antioch you've had an opportunity to do that. We tend to often, I can speak for myself as well, I think it's hard when you're in the world to remember to be a critical thinker when we're surrounded by so much information, and we're really lucky to just try and show up and understand what we can. And to take it a step further and be reflexive and say, where is this information coming from? What is the agenda of the information? What kind of context in terms of history or power or ideology is informing the information that I'm receiving? And I think it's particularly important in psychology because there is a kind of impositional power that comes with the presumption that we think we know what normalcy would look like. And so I think it becomes particularly important to take responsibility for that and to challenge ourselves in terms of what we're taking for granted. When we're in a time that is often dictated by withholding information and trying to make things as standardized and efficient as possible, it tends to eliminate a lot of opportunities for the poetic and the human. So I don't mean to sound negative. I guess from my perspective, that's one of the reasons why I feel so privileged to do narrative therapy in this world and to take a position that deconstructs the more dominant way of looking at psych. To me, that is an incredible privilege, but not the way the world tends to perceive things. And unfortunately, we're not always taught in school to be critical thinkers. I think that at Antioch, we're very much taught to be critical thinkers, but a lot of education is about being passive, not being active. Right? So that would be my position. What do you think? It's everybody's responsibility in this room to decide what they want psychology to mean and how they're going to show up in their lives and in their clinical work. That doesn't mean I think that one can't do beautiful work in many different modalities. But I do think it's everybody's responsibility to ask themselves in very conscientious ways, are your practices matching or congruent with your own integrity as a person and what you want to see in the world? But I told you I'm rather political about these things. Does that make sense? Right. Honestly, I feel like students at Antioch are certainly partly here because they're the kind of people often that take that kind of approach to thinking and to what they're doing. I'm often very suspicious, you could say, when people use language such as codependent or we have communication problems. My first interest is to ask, what does that mean? Because the chance of my meaning of those words and their meaning of those words being the same is pretty unlikely, right? And so I think that when we don't bring a social constructionist lens to language, we tend to just accept language as if it's a neutral delivery system, right? Like you send out a message and it comes to the other person and is received in exactly the form that it was sent out. Whereas from a social constructionist position, we really need to understand that person's meaning. And there's only one way to discover that, and that is to ask. And so I've often, I would say most of the time, encountered very, very different meanings, particularly with something like codependence, which is so sort of meet and pat in a sense in our discourse, that clients are assuming I know what it means. What do you guys think codependence means? Any thoughts? Yeah.
You needed to have your identity built upon being needed by another person.
Okay. Yeah.
I always think of Schnarch's idea of being less differentiated. You know, where you're in a relationship where you need the other validated. You know, the other person to validate you. And,
Okay. Anybody else? I mean, I don't consider those descriptions even that similar. So, I mean, for me, the problem with the word codependence is that they're depending on me having certain assumptions of what the words mean, right? And so it's supposed to be a shortcut, and yet it's too much of a shortcut, right? Because I even have a couple where both members are saying that they are codependent, and it turns out that for one person it means it's hard for them to state what they need, and for another person there's the interesting question that comes when you look at codependence from a postmodern lens, which is, are we just relational? Is this being imbued with a certain meaning based on the fact that we are going under sort of individualistic discourses in society a lot of the time, so that if you're not just solely independent, or if you're using, let's say, a more collectivistic family structure as what guides you in the world, that somehow now you're codependent. And so there's that privileging of individualistic values, in a sense, that discount what may be something that is held precious by a person, right? We're deciding that everything that might fit under this world of codependence is a negative. Okay. And so that's why my first job is to deconstruct what the client is actually experiencing when they're using that word.